Hi, everyone. Thank you for joining us. My name is Alexandra Olsen. I'm a communications officer for alcohol at the WHO Regional Office for Europe. I'm really happy to welcome you to this webinar on alcohol taxation and pricing policies. This is the second webinar in a webinar series on alcohol and cancer, developed by WHO Europe and the International Agency for Research on Cancer, IARC. The webinar series is part of the WHO EU Evidence into Action Alcohol Project, EVID-ACTION, which is funded by the European Commission. The project supports EU member states, as well as Iceland, Norway, and Ukraine, in adopting and scaling up best practices to reduce alcohol consumption and related harm. Please note that this webinar is being recorded and will be made publicly available on WHO Europe's website as a resource for continued learning and dissemination. Today's session focuses on economic levers, taxation, and pricing policies. We will explore new findings from WHO regional reports on alcohol and affordability. We will hear about some practical examples and introduce a brand new toolkit to support policy implementation. For some of these new products, we would like to acknowledge the generous contribution of the government of the Kingdom of the Netherlands for making them possible. I would like to say a few words about the format and structure of this webinar. As I mentioned at the very beginning, the series was created jointly by WHO in Europe and IARC, building up to the launch of IARC's new handbook, 20B, that evaluates policies to reduce alcohol consumption and harm. The handbook is planned to be officially launched in October this year. To learn more about IARC's work and the handbooks, you can have a look at the previous webinar in this series, and I will share a link to the recording in the chat for you to view later. So in this webinar series, we will unpack some of the results of the handbook evaluation in a plain language and interactive manner. We'll have a Q&A format with 4 planned segments. And additionally, we encourage everyone joining today to ask our experts questions using the Q&A function and the chat. With this, I would like to introduce our 3 main speakers today. Just give me a second. And there they are. So our speakers today are Mindaugas Štilemekas from Kaunas University in Lithuania, Daniela Correa, a data scientist and WHO consultant, and Dr. Jürgen Rem, senior scientist from the Center for Addiction and Mental Health in Toronto, Canada. They will unpack alcohol taxation and pricing policies, a very complex topic, I must say, in plain language and by introducing all the relevant concept to us non-economists. Though I don't know, maybe someone online is an economist, but not me for sure. Colleagues, before I start asking you some questions, I would actually like to start by asking our audience a question. So audience, I hope you're ready to get engaged in this. And the question is fairly simple. It's, what is it you think of when you hear economic interventions to reduce alcohol consumption and harms? We're going to do this on Menti, and I'm sharing the link in the chat now to everyone, hopefully. Let's see, hopefully people are seeing this. I would like you to go in and give us your first associations with this concept. I'm going to give you a minute for this, and I'm going to share it live as well. And in case you cannot see the link, I will also share it on a slide now. Just give me a second. Okay. Looks like people are submitting. And we have some words appearing on the screen. Okay, let's see if we can get a few more. Okay, so we can see many concepts that we recognize here: taxation, tax, minimum pricing, high impact policies, win-win-win. Excellent. Feel free to contribute a few more, but I think that's interesting for us to set both our expectations for what we will be looking at today and hear your first associations with the topic. I think that is very interesting, and it'll be good to hear from you, our experts today, on what you think also of our audience's associations. So I'd like to kick off our first expert segment and start with economic interventions that were evaluated as part of the IARC Handbook Volume 20B. For this, I'd like to ask you the first question, Mindaugas. You were the chair of the working group looking into these economic interventions. Can you tell us what was evaluated and by whom?
Yes, hello everyone. So I will quickly share my slides with everyone, and that hopefully will contribute in more clearly seeing what was evaluated. So in Handbook 20B by the Handbook of IARC, we evaluated 3 segments of selected alcohol control policies related to taxation. And naturally, the first one was the excess taxation and sales tax, which is basically a category which generates revenues for the governments. And what was very important here was not only to speak about the taxation itself, but also to establish a clear link between the tax and price. And I will briefly speak about it shortly. And then another 2 categories were minimum pricing and bans on discounting. So all of these policies related with taxation and price-related policies. And yeah, going back to the excess taxation, what we needed to establish and what was very important is to think about how tax is passed through to the price, and then the price is the one that affects the alcohol consumption. And here we have a general principle of market demand. When you increase the price, then the quantity demanded of the specific good, in our case alcoholic beverage, is reduced. Yeah, so we needed to establish a link between the tax and price, and we also included as an additional supplementary review and complementing information this review of the pass-through, which is basically giving us entire pass-through of the tax to the price. There are some, of course, exceptions where you may have slight undershifting or some overshifting of the tax to alcohol price, but what we in general were able to conclude that we have a pass-through effect clearly visible of tax switched to the price. After establishing this, we also needed to frame ourselves what we are evaluating. So we had several limitations. So we included the studies only that were specifically targeting with the taxation one of the major categories of alcohol. So there might be spirits, beer category, wine category, and the effect of alcohol consumption was measured in terms of change in total consumption or total sales of alcohol. Another thing, what we also were taking as a criteria was the control for income or its proxies, basically accounting for the change of affordability. Yes, so when analyzing the category of excise tax and sales, we had in total 7 studies identified out of a large pool of studies. Once again, it is very important to highlight that there is enormous number of scientific evidence showing the effects of price to change of consumption, but in this case, we were concentrating on a little bit longer pathway of the impact of tax to the change of alcohol consumption. And we were able basically to conclude that we have a sufficient evidence here. What is also important here to highlight that we had studies from different countries, starting from several OECD countries, and then Sweden, United States of America. We had several studies from there, Australia and Hong Kong. And basically different studies, different interventions related with excise taxation and sales tax. And we concluded that there was a sufficient evidence that there is an effect of tax in reducing or changing alcohol consumption. Then another category was minimum pricing. So minimum pricing basically has a mechanism of setting the floor prices, which sets the higher than usual prices for the cheapest alcohol and sets the floor prices or minimum pricing policies in some different forms, but the mechanism is generally is the same. It generates some additional revenue for probably industry. It's not generating revenue for the government, contrary to the excise taxation, but also contributes to health in terms of increasing the prices of the cheapest alcohol. And that was also showed to be a successful policy. We had 10 studies identified in this category, which were also covering multiple countries, mostly Scotland, but also there was some evidence from Canada, from Australia. The conclusion was that there is sufficient evidence to conclude that minimum pricing policies are working well, and we were able to conclude that there is a category of sufficient in terms of our grading of 3 different categories. Then the final category we had was the bans on discounting. The bans on the discounting might be policies related with happy hours, off-premise sale, discount bans, or some type of free gifts when you purchase alcoholic beverages. And here we had only 3 studies identified. Also, all 3 studies were coming from the same single country. It was Scotland, and it was based on the same ban. It was Scottish partial ban on multi-buy discounts of off-premise alcohol. This ban was implemented in October 2011. And the evidence, interestingly, were inconsistent in between the 3 studies. So one study showed the slight reduction in sales data by 1.7%. Another study showed the increase of weekly alcohol purchases. And then the third study showed that there was no change. So basically, there was no statistical difference there. And yeah, the conclusion for this category was that the evidence was inadequate. Basically, the reasoning was that, of course, the number of studies was relatively low, but also we had only one policy intervention in a single country. So that also contributed to the conclusion that we had inadequate evidence here. So probably I will stop here my monologue and happy to answer any additional questions.
Thanks a lot, Mindaugas. I think that was great to go through those. Just to make sure that that I understood correctly and that we all understood. So the categories there of strength and evidence, what is it they like? What can you repeat what they mean? So does it mean, for example, that bans on discounting of alcohol don't work, but taxation and minimum pricing works? Or is this about, how much there is of available evidence?
Yeah, so starting from bans on discounting, it doesn't mean that it doesn't work. It just means that we do not have currently enough evidence to draw a conclusion whether it works or it has an opposite effect or something like that. Basically, we need more research into this area. Probably that would be also a call for more research using this opportunity in this specific area. Then we are moving to minimum pricing, which gives us sufficient evidence that minimum pricing reduces alcohol consumption, especially in the specific groups. And then we had the excise taxation, which is probably the best policy because it also generates additional revenues for the governments, but also allows us to reduce the alcohol consumption. Yes, and we also had enough studies from different countries, from different policy interventions to conclude that this provides us sufficient evidence.
Great, thanks a lot. I think that's super clear. And then you said that there were three options for strength of evidence in this IARC handbook evaluation. So I can see sufficient and inadequate as the options there. What was the third option?
It may have been limited evidence.
Okay. All
There's
right.
something in between, yeah.
That's something in between. Okay. Well, I think that's good to know. And then I think you already answered this, but just to say, in your opinion, which would you say was the strongest economic intervention to reduce alcohol consumption and harms?
Yeah, I would repeat again, it's the excise taxation, because it not only gives us the potential to reduce the alcohol consumption, but it also generates the revenues for the government. And naturally, this is a win-win situation, as we just saw from this exercise with the audience, that there was win-win-win, one of the answers. I really liked it.
Yes, exactly. So that's definitely, if there's one which is a win-win-win policy, that's the one. Thank you so much, Mindaugas. For our audience, I invite you to ask questions here in the chat or in the Q&A function. Mindaugas is also here to answer some of these questions, and we will also have a segment where we can take some of your questions live, but please feel free to use the chat and Q&A for that. I'm going to go to you now, Daniela. Mindaugas, you can maybe stop sharing your slides. And so, Daniela, we heard from Mindaugas that taxation and pricing policies are impactful, there's sufficient evidence, but where does Europe stand with implementation of these policies? Could you tell me about the findings of the new WHO Europe report on prices, taxes, and affordability? What are three of the key messages of this report?
WHO just launched a couple of weeks ago this new report called Alcohol Taxes, Prices and Affordability in WHO European Region in 2022. And and this sets the scene on how alcohol prices and taxes are currently in the region. And the three main key messages that I can share with you are the following. So the first is that there are still major implementation gaps. So alcohol taxation is currently still very underutilized in the WHO European region, sorry. Despite what Mindaugas just mentioned, that it is the most cost-effective tool we have to reduce alcohol consumption. Yet it is not applied consistently, and we are definitely not using it to its full potential. For example, if you look at figure 1 that I have here in this slide, you will see that while excise taxation is applied to beer and spirits in all countries in our region, for wine, almost half of the countries either do not impose excise taxes or apply a zero rate. And those are the countries here in the dark blue. And most of these countries are EU member states. And this happens mostly because of the current EU directive on alcohol taxation that is now more than 30 years old, but still allows zero tax rate for wine. The second key message is that alcohol remains highly affordable in the region. Affordability has been increasing in many countries, and this is mostly because tax rates usually do not keep pace with inflation or the income growth. And this is especially true for EU countries. And if you compare the average of the WHO European region with the average only of EU countries, you will see that alcoholic beverages are around 60% more affordable in EU. And the third major key message that we can draft from this report is that raising excise taxes can indeed result in measurable benefits, not only for health, but also for revenue, as once again Mindaugas just mentioned. So basically we have 3 countries that we used as case studies in this report. Those are Germany, Portugal, and Georgia. And we show that if we increase the tax rates enough to increase the price of the alcohol beverages by 10% approximately, we will see a reduction in consumption that goes from 4% to 8.5%. And that this reduction in consumption will lead to a reduction in mortality, in total mortality, by up 2.5%. This means that more than 2 out of 100 deaths in the country can be avoided with a very small increase of alcohol excise taxes. And this number, and that's something important, is that this number only considers immediate causes, such as cardiovascular diseases or accidents, and doesn't even include long-term causes like cancer, for example. Yeah, and in addition to all these benefits in health, these will represent millions of increase in government revenue. And that's why we see measurable benefits in both health and revenue.
Great, Daniela, thanks a lot. I think that's super interesting, and thank you for really outlining the key messages of the report. You talked here about the concept of affordability. Could you just define it a little bit more for us, just in like very simple terms? What does that mean, affordability of alcohol?
Sure. So affordability basically reflects how easy it is for people to buy alcohol relatively to their income. So it's not just the absolute price that matters, but also how much people earn. Even if prices are high, alcohol can still be affordable if the income of a certain country it's very high. So what I'm trying to say is that the price of an alcoholic beverage in Portugal is not necessarily comparable to the price in say Finland, because the two countries have very different incomes. So the idea here is that if we want to compare prices directly, we first have to convert them into international dollars. International dollars is like a non-existent currency, but is a fictitious currency that is created to reflect the local or the national costs of living. And it's calculated or is estimated using an index called the purchasing power parity, or PPP, as we usually call it. But if you want to estimate affordability, then prices are not enough. And what we do is basically we calculate how many standard units of alcohol, such as, for example, cans of beer or bottles of wine and spirits. So how many standard units of alcohol can be bought with the average household consumption expenditure per capita in each one of the countries. And that's what gives us this comparability measure of affordability. And that's how we say, for example, that in the EU, in the European Union, people can buy many more bottles of alcohol per year with their income than outside of the EU in our region. And that's what makes alcohol affordable and accessible. And that's also what is reflected here in figure 8, where we see how many bottles per capita or how many bottles a person can buy in 1 year using the per capita household consumption expenditure.
Okay, thanks a lot. And that I can see that's what you have there on the graph at the bottom. I think that's very clear, and the differences are very big actually in the big numbers. It looks pretty drastic. Can I also just ask a clarifying question, because you said you named a lot of different numbers and percentages there in the impact that alcohol taxation can have, where you looked at the case studies. So in a nutshell, can you just summarize that one for us? So what you have seen in the 3 country case studies, if you raise alcohol taxation, what happens?
Yeah, so our case studies were using a scenario that was what would happen if you increase the tax rate in a way that it reflects an increasement in price of 10%. So, for example, if a bottle of beer costs €1, we would increase the tax rate, so it would cost €1.10. And what we see is that obviously it depends on the alcohol consumption level in the country, and that's why we used 3 countries with very different drinking patterns. But we saw that the alcohol consumption reduction would be around 4 to 8.5%. And that small or apparently small reduction actually meant avoiding a lot of deaths. So it meant reducing total mortality of immediate causes. So let's for now not consider cancer. That's small or apparently small reduction in consumption would decrease mortality, total mortality, in 2.5%. So
Okay.
a big impact, and that represents a lot of lives or deaths postponed.
That's okay. That's I think that's fascinating. So I think clearly in that example you gave, right, the increase in price is fairly small, barely noticeable. The reduction in overall alcohol consumption may seem fairly small, but then the lives saved or deaths postponed, as you just said, I think is very very visible. And again, also just an estimate, right, of the actual impact that it could have from some of the other causes. Great, thank you so much, Daniela. I think that's really great. Clearly, alcohol is pretty affordable in Europe, and policies are not being implemented sufficiently across all European countries. So I'd like to go now to you, Jürgen. So Daniela, you can maybe stop sharing your slide. And Jürgen, I'd like to ask you about tools for implementation. The WHO Europe has also just released a toolkit on implementing taxes and pricing policies. Can you tell me, start by telling me a little bit about that?
Yes, I hope you can see my slides now.
Yes, thank you. We can see them.
And it's always great to have those good examples. You should increase taxes, as if it's so easy to increase taxes. And so one of the efforts was to look into the situation of what can be done to actually implement taxation and or other pricing policies, and to produce a toolkit. And this toolkit has a number of easy steps. Importantly, it starts with a problem analysis. Obviously, people think about increasing taxes for a number of reasons. But in terms of public health, countries are way more prone to increase their excise taxations on alcohol if they have problems from alcohol. And then the steps they take should in part be informed by an analysis of the situation of public health, of alcohol attributable problems, health problems, social problems, which are caused by alcohol. And so that is the first step. Then you analyze which taxation format or which other pricing policies could deal with that. And you start looking for coalitions, for people who think the same, for what can be done to actually get to the point where Parliament can consider something. Once it is done, you look into implementation. When were there important considerations? And we've learned that in several countries. Just to give you one example, if you decide about a policy and the policy is decided in Parliament to happen in 5 years, I guarantee you that the policy will be way more contested. There will be a lot of chances that this policy never, even though it was decided in Parliament, will see the light of the day. So you should try to do policies which can be implemented relatively quickly. That's only one point. There's also tips about common challenges. And finally, there is monitoring and evaluation. Why do we do monitoring and evaluation? Well, very simply, if we don't do monitoring and evaluation, we have problems in knowing what went right, what went wrong. We should see every policy as a experimenting society. We do not know always what is coming. We do not foresee things like COVID. We did not foresee certain wars. So we need to adjust our policies to the new situations. And in order to do so intelligently, we need to know what worked, what didn't work, despite best intentions from Parliament, etc. And then you should explore what can be done to improve implementation, to improve enforcement, etc. So this is a very practical guide with lots of graphs showing what can be done, what what are the options. And of course, WHO would also be available to help implement such policies.
Thank you so much, Jürgen. I think that's excellent. And I think walking through the practical steps, that's really useful. We have a lot of discussions in the chat on various topics. And in the Q&A, we got a question which I think would be interesting, would be something you could answer here. And it goes, in today's world of increased tariffs, our Canadian government are very tax averse. What is the one message you would put forth to governments to justify excise tax increases, as they don't seem concerned with public health?
Well, it's not a good sign if governments are not concerned with public health in the first place, but I know there are governments who are not that much concerned about public health. But taxation is not something which had been invented by public health people. If you look into the textbook of economics in the 1920s, there is already a very clear analysis for how capitalism works and what should be done. And in this analysis, a French economist, Pigou, basically said a government should tax goods to the degree that they cause government and society additional costs. Alcohol causes a lot of costs to government. Think about all of the hospital costs. Think about any other healthcare costs. Think about policing. Think about just the legal system in general. These costs are enormous, and they have to be borne by all of us, all taxpayers. And in order to help societies and governments pay for the costs of alcohol, taxes should be implemented to the degree that they cover those costs. Now, there have been a number of analyses, and guess what? Our taxes are way, way, way too low to cover all of the costs of alcohol. So de facto, we are all of our society is paying to sustain the current low prices of alcohol. And that makes a lot of sense for each government to make this analysis and think about how to at least get some of this money back.
Great, thank you. Thanks a lot, Jürgen. And just to follow up to that, what would you say are some of the typical questions that you get from policymakers when it comes to taxation and pricing? So what are some of the common things that they would like to know?
Well, first of all is, well, let's put it this way. I've been to, I would say, around 15 to 20 parliaments in my life. And in each parliament, those two questions were part of the questions. The first is there an optimal taxation system? And how would we do it? And the second is, can you guarantee that if we increase taxes, that people do not start drinking illegal or other unrecorded alcohol? Those are the two main questions we are hearing.
And how do you answer those questions then?
Well, based on the situation of the country, but the basic gist is unrecorded consumption, illegal consumption is something you should think about when you do taxes. Not that it is inevitable, or on the contrary, There are lots of myths about illegal alcohol and how it will increase. And when Lithuania did increase their taxes by 100%, it was close to the end of the earth, etc. Nothing of that happened. But still, there may be, in some situation, increases in unrecorded consumption. And when implementing taxation, you should think about your country. What is the chance of unrecorded consumption? What is the tradition? And you can do things against that. And that has to be done. If we are asked about the best taxation system, we usually say it is always best to tax the strength, the alcoholic strength of beverages. And that can be done with some, which should be proportional. So taxes for, let's say, a beverage of 6% should be higher than for a beverage of 4%, or a beverage of 20 should have higher taxes. The specific taxes should be related to the alcohol beverage content. And then there's a lot of tricks, and I don't go into those tricks because it would take too long.
Okay, thanks a lot, Jürgen. And I think you already flagged when talking to the first part that WHO is available for support for these kinds of situations. It's not, for sure, not always one size fits all, and the tips and tricks vary on the context. So I think that makes sense, right? Yeah, go on.
I have one more slide, or one more message, because we are talking about cancer. We did some back on the envelope calculations on what would happen in the EU only if taxation would be increased based on what we learned in the handbook. And there are two scenarios we are doing. One is, one of those evidence pieces had taxation increases on beer, spirits, and wine. It was one of the pieces which worked. And another sensitivity analysis which we did was, we took Sweden and the Swedish taxation and asked what would happen with cancer if everybody applied the Swedish model. And if we look into that, how many cancer cases would have been avoided if 10 years ago we had implemented the example from the IARC Handbook, and that would have led to about 7,700 less new cancer cases in the EU. Now, what if all of the countries had implemented the Swedish taxation level? That would have been almost 40,000 less new cancer cases. And this is not immediate. Cancer is slowly developing. We are usually calculating this would come over 10 years. So don't tell any politician, oh, if you do this taxation, cancer will go down immediately. It will not. But you can say over the next 10 years, you can gain that many cases. And you can also avoid over those years, if you do this implementation from the article of the handbook, you would increase prices of beer by 4%, spirits by 33%, and wine by 19%. And that would result in about 2,600 less cancer deaths over the next 10 years. And the same with Sweden, it would be around 16,000. That's just to give you what we are saying about taxation is really highly impactful, and alcohol is touching more than 200 disease categories, but only in cancer, which is around 20 disease categories related to alcohol, 7 main cancers, and it would have already those effects.
I think that's a really really powerful point, Jürgen, and I think it complements also the points made by Daniela earlier, that there's an immediate effect on some of the conditions directly related to alcohol, and we can see them and they save lives. There's also some delayed effects, and it really doesn't take much to begin seeing those effects. So I think that's some fantastic practical examples. Thank you for showing those. I would just like to once more show you these two products that that you both talked about. All right, there they are. If you are for scanning QR codes, you can do that. I've also shared both links in the chat of this webinar, so we definitely invite you to explore them depending on your job responsibilities and what's relevant here. I think both bring a lot of very interesting insight beyond those that were shared with by our experts today. Another guest, it's Jeroen Frerichs, Senior Policy Advisor at the Ministry of Health, Welfare and Sport of the Kingdom of the Netherlands. So I think here we can also hear from you, Jeroen, a bit of a country policymaker perspective on the topic and on the work being done here. If you're ready to take the floor, Jeroen, I'd like to give the floor to you.
Thank you, Alexandra. And I'm sorry for being late because I was supposed to say something at the beginning of this webinar, but there was a misunderstanding about the starting time, so I could only join now. But still, thank you for the opportunity to say a few words at this webinar on tax and price policies. I think, well, in my view, both the report and the toolkit are very important to reduce alcohol consumption and improve public health. And I would like to point out a few aspects why I think that is the case. The first one I would like to mention is that I think these products contribute to evidence-based policy making, because in the field of prevention, we're sometimes struggling to find evidence for the causal relationship between the interventions we do and the effects. And I think in the report, yeah, there are some clear examples of evidence on both the reduction of alcohol consumption and as well as a decline in mortality, for example. So that's one important thing I would like to point out. Second thing I would like to mention is that I think these products could contribute to learning from each other and cooperation between member states, because I think the report gives an excellent overview of how the member states have implemented policies regarding taxing and pricing alcoholic beverages, which I think is useful for policymakers to see how other member states do it, what are good examples, what are maybe less effective examples. And I hope it will also contribute to cooperation between member states, because I think what is one factor, what is maybe hindering an effective implementation is that if you want to increase the price, there are signals that it could lead to cross-border effects. And if policies between member states, especially neighboring states, are more harmonized, that argument, you can easily counter that argument. And last thing I think I would like to mention is that it's also really practical, this toolkit. It's focusing on supporting government officials and how to formulate these policies, and it provides an overview of actions required and even a checklist. So I think that makes it very useful to actually work with this product. It's not only an example of theoretical evidence, but it's also very practical. So that's what I wanted to say at the beginning, that I'm happy with these products, and I would like to thank and congratulate the WHO for these excellent publications.
Thank you so much, Jeroen. And I think that's fantastic, and even I think answers a couple of questions that came in from our audience in the chat, including also, what are some of the convincing arguments and helpful support tools that we can give decision makers, especially in regions with an influential alcohol industry as well. I think this is something we did not get into too much into this webinar, and could be a whole other topic. But I'm wondering here, maybe also before we end, if Jürgen, you could also mention a few of the findings from the countries that you've seen in terms of this argument about cross-border trade and the effects of that, and maybe your own here, you mentioned that there are some really good best practice examples. This was also a question that came up here in the chat. Maybe you could name a few practical good case examples of countries that have gone ahead with implementation of taxation and pricing policies.
Okay. I'll give them for the EU first, because I think most of our audience is from the EU. Lithuania was one of the countries who experienced quite a lot of alcohol consumption. There was a WHO report which was based on, which was published about 3-4 years after the fact, where Lithuania was #1 in the world, which stirred quite a lot of problems in the country. And one of the consequences was that the country seriously thought about reducing alcohol consumption, and they implemented taxation as the first measure. And then within 1 year, they also implemented availability restrictions and a full ban on marketing. So what happened? The taxation was increased by 110% for beer and wine, and by around 20 to 30% for spirits. All hell broke loose. There was newspapers saying, this is never possible. People will go to Latvia immediately. We are a small country. The borders are so close. Everybody will go, etc., etc. So there were even protests in the streets, and there was an initiative by alcohol industry. They had a bus going to Latvia, which was for free. You could join, and then you could shop in Latvia, the cheaper products, etc., and bring them back to Lithuania. So everybody said this will never work, and there will be cross-border issues, especially we know it may work in China because that's a big country, and the people cannot go to another country, but it will never work in a small European country like Lithuania, where the next border is just 2 hours away. Anyway, what happened is nothing. There was no increases in unrecorded consumption. The people, they did go over the border, but that was mainly people who lived very close to the border. And for the whole rest of the country, there was really no contest. And at the end of the day, we saw the following. Lithuania reduced because of these price increases, they reduced their overall all-cause mortality by more than 1,000 people. And that's a lot. That's 12% less deaths in 1 year when in the year after this tax increase was implemented. And they gained over 100 million euros new taxes. So it was really something which was a full success and nothing happened. Now, is it always the case? No. There's another example from the same part of Europe. Both Estonia and Latvia have been trying to lure Finnish people over the sea to buy cheaper spirits, mainly, but also beer and wine in Estonia and Latvia. And they have been competing with new ports and a lot of shops next to those ports. So the Finns could just come over, buy the cheap booze, and then they started something like a tax war. So one started decreasing taxes, the other followed because they wanted to have the Finnish tourists, and that was a poor catastrophe. Now, that was based on, the stupidity of the governments, not talking to each other, but to try to outdo themselves in the wrong direction. And those things happen sometimes. And the only solution there was, and that's the solution which is now happening, that they speak to each other. Oh wonder, their capitals are less than 500 kilometers away from each other. So they speak to each other, and in future, they promise to do their taxation policy in a more concerted action. And as had been said by the speaker before, I don't see why governments cannot be that rational, at least, to talk about their changes in taxation to their neighbors, to discuss things, to maybe come up with a common plan. After all, we have one EU, and that is one of the minor points given the problems of this world, to come up with a common taxation plan for alcohol. I'll stop here. I could give you another hour of examples, but I think those two were in both directions were the most significant in the last 10 years.
Thank you so much, Jürgen. I think that's exactly that, and a good key message that both Jeroen formulated and you formulated here, that talking about it can make the strength of these policies even more, and can bust some of the arguments that are being posed against the measure. So we only have 1 minute left, and I'm going to give a bit of an impossible task to my colleague, Catherine Paradis, Technical Officer in the program, to close this session for us, please. A word over to Catherine, thanks.
Thank you, Alexandra. Thank you, everyone, for a very rich and illuminating conversation. And I want to extend my sincere thanks to the Netherlands, represented by Jeroen Frerichs from the Ministry of Health, Welfare and Sport, for supporting this work, and now also highlighting its usefulness, not only for implementation, but also, as he mentioned, for cooperation between member states. I think that's very important. Of course, I want to thank our three speakers, Mindaugas, Daniela, and Jürgen, for breaking down what is often seen as very technical and dense topic, but showing us just how powerful tax and pricing policies can be in reducing harm, including mortality and cancer incidents. So you've really helped us to see that these interventions are just not, they're not only economic levers, but they're really public health tools, tools that are underused, as you mentioned, Daniela, undervalued, and in many countries misunderstood. But as we've heard today, we now have stronger evidence than before from the IARC Handbook, from the new WHO report, the toolkit to challenge those perceptions and to begin shifting the conversation. So this is exactly what we're doing in this webinar series. It's not just about sharing knowledge, it's about building momentum. They are helping us getting ready in October, when we will all meet in person in Copenhagen. That means we won't be starting from zero. We'll be building on this foundation, drawing on everything we've learned to develop bold, coordinated, and credible responses, especially when faced with the kinds of pushback that we know will come and that some of our participants have highlighted in the chat box. So for our EVID-ACTION Network members, I hope that you find this really helpful. For everyone else who joined also today, thank you for being part of this conversation. And I warmly invite you to register for the next webinars in this series. I think Alexandra has put the link in the chat box. Yeah, thank you, Alexandra, for moderating this. My time is up, so I'll just stop here. Thank you.
Thank you, everyone. Thanks to all of our speakers and to you for watching. Thank you so much. Bye.